Welcome, everyone. Good morning, good afternoon, and good evening, wherever you are in the world. Thanks so much for being here with us for this opening plenary on day 3 of the Global Digital Health Forum. It is such an honor and a pleasure to be back. I've been part of these events now for over a decade, and so I always say it feels like being with family to be back amongst this group. So thanks so much to the organizers of the forum and everyone who is working in front of the camera and behind the camera to make this possible. We really appreciate you. So the theme for the forum this year is improving health through digital transformation. And we're really taking that topic full on here in this panel by talking about what it means to not just do digital on the margins of programs, but to really pull that into the mainstream of the work that we do and be digitally enabled, be digitally transformed organizations, so that eventually maybe we're not even talking about digital health anymore. We're just talking about health, and it's implied and understood that we are fully embracing digital technologies as part of the way that we do that. But of course, we're not quite there yet. We're well along the process of thinking about digital transformation, bringing it into the programs that we do. But to get that right, we really need to be deliberate about it. And there's some compelling reasons to do so. We know we've got really ambitious global health targets and the health-related sustainable development goals and UHC targets. And we're going to need digital technologies to help support access to information and data and service delivery at all levels of the health system, to provide access to the information and data needed to support informed decision-making. And that's whether you're a client, a health worker, a health systems manager, or beyond. And then, of course, in the context of the past 2 years, we're seeing digital playing an increasingly important role in all aspects of society, including in health. And we have a recent report that came out by the Financial Times and the Lancet Commission talking about digital as a new determinant of health. And I think that's incredibly powerful and is an important rallying cry for us to think about how we navigate these digital transformation journeys. And yet we know digital is not yet everywhere. And even where there is digital connectivity, its access to it is not evenly distributed. And we're reminded again in the context of COVID-19 with misinformation and disinformation that digital technologies are not inherently positive, that they reflect the intentions and the capacity of the environments in which they're used. And finally, we know that these use environments are so critical to enabling digital technologies to be used as intended, and for the data they provide to be used as intended to support decision-making. And so I imagine that's a topic we will hear a lot about. So with us today to talk about all this and more is an exciting panel who will bring us perspectives from Ukraine on building digital services, from Uganda on delivering community health, and globally around data collection and analysis from citizens. And so speaking to those perspectives, I'm really pleased to welcome Elizabeth Villarroel from Deloitte, Ukraine, Jessica Oyugi from UNICEF Uganda, and Chris Watson from Premise. And of course, we have an honorary 5th panelist. This is a surprise in the program here. And so I'm really pleased to announce that you listening to this panel are really welcomed to be part of this discussion. So please do use the chat function. You'll see way in there teeing you up to introduce yourselves and share a little bit about who you are and how you're approaching this topic, where you're located. And that is for you to be able to network to the best of your ability there in the chat room with your fellow participants, recognizing that we can't all be together as we would like, but also so that we can hear your questions and incorporate your perspective in this discussion. So please don't be shy. Use that as an opportunity to communicate with each other and to communicate with us. So with that, let's get the discussion started. And to do that, what I'll do is hand it over to the panelists, ask you guys to introduce yourselves and to reflect in a minute or two. In your experience, where do you see the greatest value in digital transformation? How is it relevant to and potentially accelerating of the work that you do, and use it as an opportunity to tell us a bit about your work? So I'll go in the order of Jessica, Elizabeth, and Chris, and Jessica, hand it over to you.
Thanks so much. What a wonderful welcome, Adele. Very much appreciated. And good morning, good afternoon, good evening to everyone that's joining us today. My name is Jessica, and I lead the community health portfolio at UNICEF Uganda. I do that with funding that comes from the Rockefeller Foundation through a partnership called ICOS, Intelligent Community Health Systems. This has been an important engagement for us. It has about three main objectives. One that lies around governance and sort of supporting the government of Uganda with strategy development for community health. And as you mentioned, Adele, a very important and timely topic in order to use communities as a platform for primary healthcare on our road to universal health coverage. We have a second objective, which is exactly what you touched on as well. How do we use data to support decision-making at all levels of the healthcare system, from the community, the subnational district level, all the way up to the national and policy-making level? And then an exciting component of Objective 3 of ICOS in Uganda sits at a decision support tool for our community health workers in Uganda. And I think it's really at this household level, at the community level, where we've been able to see a very important intersection of the digital good that we can bring in supporting these community health workers with technology that allows them to make better decisions, to be better supervised, and to support them in supporting the clients, the mothers and children that we serve in Uganda. So I think a little bit later, I'll talk to you about how we've been able to use this platform to support the government of Uganda in other government-led digital initiatives that I'll be happy to talk about a little bit later. But thanks so much.
Great. Thank you for that. Elizabeth, over to you from your perspective, the greatest value.
Great. Thank you, everyone, also for joining us today. This is a great honor to be part of this panel. To get started, okay, I am currently the chief of party of the USAID, UK aid funded health reform support project here in Ukraine. I have in my previous life also focused on some cybersecurity initiatives and governance efforts. Our project is quite unique in the sense that it does sit within global health, our priority being to ensure quality healthcare for all Ukrainian citizens. However, it does have a very strong cross-cutting theme of anti-corruption. I think one of the things that I think is valuable to answer Adele's question is really the opportunities that digital brings to citizens that will inevitably touch the healthcare system. I think health is one of those very unique sector areas that does end up touching everyone at some point in their life. So a very unique opportunity to be able to bring transparency, awareness, and accessibility to its citizens. A bit later in the panel, I will also talk about some of the work that we're doing to safeguard some of the enabling factors that digital has brought to the health space here in Ukraine. So also looking at the positive and the negative sides of digital and making sure that we're all aware when we take one foot in from doing to being digital. Thank you.
Great, thanks. I love how you framed it from the perspective of citizens who need healthcare services, because I think that is something we sometimes forget in our zeal to deliver effective health programs that, of course, people need more than health. And as we think about digital transformation, we should be mindful of that larger ecosystem. So maybe that's something we can pick back up on later. But in the meantime, Chris, speaking of citizens, tell us a little bit about where you see value.
Thanks, Adele. Appreciate it, and glad that everybody around the world has been able to join us today. It's a real pleasure. So my name is Chris Watson. I run the International Development Division here at Premise Data. We're a technology company. We've built a crowdsourced data collection and insights product that lets both like commercial businesses, mostly kind of global 1000s, but also startups, and government and international development actors tap into a network of citizens all around the world who get paid to do data collection tasks in their community. And the problem this is solving is that there's just still so much data we need that involves sending somebody out into the world to collect it. And doing that can be a real burden on people's time. And honestly, that's where I see some of the greatest opportunities in digital transformation. Like when I joined Premise, I read an article that sat with me by a kind of business thinker named Clayton Christensen, and it's called Know Your Customers' Jobs to Be Done. And the theory is anybody who decides to buy or use a product does it because it does some job for them that they need solved. And my experience, especially working with governments in low and middle income countries that are using Premise, is they just have too many jobs. There's the amount of work that they do or need to do greatly exceeds their staff, capacity. And so whether that be up at the decision maker level or national level or down at the community, I really see a lot of potential to for technology to serve as a force multiplier, given everything that needs to be done. But when it's done poorly and it adds work, which some of us who maybe were using Salesforce 15 years ago thought that was an extra job as opposed to solving a problem we had, it can go the other way. But if it's done right, it can be a real force multiplier. And I'm looking forward to kind of unpacking some of that. Thanks.
Great. Thanks, Chris. Appreciate that. So from my perspective, working at USAID and the Global Health Bureau, there has been a lot that we've done just really in the past year and a half, and are thinking about when we think about strategic digital transformation. We had our Global Health Bureau chief giving a keynote on the opening day, talking about the digital health vision, which is USAID's first policy document that covers the way we make our investments in digital technologies as part of our country-based global health programs and some of the core priorities. And so I'll be layering in, as I have moderator's prerogative, some of those perspectives, but just to quickly chime in from a USAID perspective, I think one of the most important things that we are looking to achieve when we think about strategic digital transformation is how we can be best partners to the countries that we serve, and taking an overarching planning lens, looking at national digital health strategies and national digital health architecture can really help not only ensure that countries have a plan, but that from a funder and partner perspective, we have a roadmap that we can seek to align our efforts to, and that we can seek to harmonize our investments with, so that we understand specifically where a country is and where they're trying to go in their digital transformation journey, and how we can ensure that our funding and our programmatic activity, together with our implementing partners, is a part of that transformation. So Elizabeth, I'm going to turn it back to you and ask you to talk to us a little bit more about the work in Ukraine with the health sector digital transformation journey there. Do you have a North Star that you all are using, or a guiding star that you all are using to help inform that work? And so just tell us a little bit about what that looks like. What are some of the big challenges? Looking at a country capacity perspective, for example, and how are you defining those, and where are you honing in on the opportunities?
Thank you, Adele. A lot to unpack there, and some very interesting topics. I think for our project, like I had mentioned, it's an interesting global health project because we actually don't focus on any service delivery. The project itself is really about supporting the larger health ecosystem be able to roll out reforms here in Ukraine. So we work at the policy level, but we also have very broad reach across the country to healthcare facilities and helping translate some of the policy decisions that are being made at like the Kiev-based national level. As we all know, sometimes those decisions are slow to trickle down to the communities. I think one interesting approach that our team has made is that we are trying to get the government, get healthcare facilities to also change the way that they look at patients. We try not to refer to the citizens of Ukraine as patients because all of them may not be patients. They are really consumers of the health system. And with that, building up the institution, which is going through a very new reform. I think for context, the first big step of the health reform here had to do with health financing in order to help curb corruption here. And so the big chunk of that was a digital piece, which had to do, which started with a central database as a health payment process system, but has now grown tremendously. I think one of the biggest challenges that we faced as a project, and this goes a little bit to the question about North Star, is that in order to meet the government where they were and provide the technical support that we needed to, the government was trying to build the plane while flying it. So a lot that took place early on were maybe not the best practices, but necessary practices in order to launch the reform. So one of the big things the project has done is be able to help the government in the last couple of years, in the last 2 years in particular, be able to look back on the larger e-governance foundational pieces that are required in our perspective to create not only a resilient system, but also a transparent and interoperable system. Ukraine has also a very unique environment, I think. In big urban centers, there is quite a big use of internet infrastructure as well as accessibility, but the country is large. And in the outskirts of that, what we learned with working with Premise actually, is that maybe access is not available to everybody. Yes, they may have phones, but they may not have data. And in Ukraine in particular, there is a Ministry of Digital Transformation that is also pushing a lot of digitally focused tools. One of the big things that I think we are trying to push and remember is that digital isn't always the silver bullet for everything. A lot of what we see here is that digital has been looked at as automating paper processes that have existed. That isn't always beneficial. And that's, I think it goes to the crux of why we're all here today. There's a lot of doing digital here and a lot of trying to sort of purchase very interesting and very innovative processes. But I think one of the things that we have helped the government with is take a step back, look at things like architecture, making sure you have an architecture map, making sure you have an SDLC framework, a cybersecurity framework. You also have the safeguards in place, governance structures. Currently, Ukraine doesn't really have a clear strategy of where the e-health system is going. However, we are currently in the process of the government of Ukraine drafting its new health strategy for 2030. So we are hoping to be able to infuse some of this thinking in there. I think just to summarize, one of the biggest challenges is that we are all going to be flying, building the plane while flying it. That is the nature of digital technology. I think it's important for us to remember the consumer piece to it and the accessibility piece. It may answer some policy related questions, but it may create a lot of issues if you don't also couple that with enough awareness campaigns, enough advocacy, enough digital literacy, so that the technology doesn't become your single point of failure in the long run. And last is really ensuring that while you are doing all of these very quick pivots in order to improve your systems, you take moments to look back and strengthen your infrastructure. So things like e-governance, making sure you have foundational documents so that you don't inadvertently create non-transparent systems. So a lot of that can happen, especially with technology, since people, not everybody feels comfortable addressing technology. And sometimes, procurements and things like that can maybe go into monopolies or other things, because there isn't a lot of transparency around where things should be or how things should look. And people are scared to maybe approach the technology in certain ways because they don't know it. So that is where I will stop. I know we will have more opportunities to unpack some more of these.
Yeah, no, that was great. You gave us a lot to think about there. I've heard this metaphor about building the plane while flying it a lot already this year. And of course, it's not a new saying, but it's making me kind of visualize that we've got a lot of partially built planes flying around here. And especially when you're flying a plane that is still under construction, it's really important to know where you're going. And so having that plan that gives you direction and remembering why you're flying the plane, which is because you're trying to transport people somewhere where they need to go. And so what is that health journey that this digital transformation is supporting, and really building those policies and the architecture, all components of this around those people and their needs, including to think about how digital interacts with people from a holistic perspective, inclusive of health. So let's pivot here. And Jessica, I'm going to hand it over to you and ask you to talk a bit about the work, particularly in these quote unquote last mile, maybe first mile settings for health delivery that we know still are largely seen as being primarily, if not purely, analog, places where digital connectivity has taken longer or is taking longer to reach. And so can you talk to us a little bit about what you see happening with the Ugandan government, which we've heard from already here at this event on a couple of panels, and talk a little bit about what they are doing with digital technology, including at the parish level with this parish development model. What is it, and how is that part of Uganda's vision for the future of digital transformation and health?
Thanks so much, Adele. It's terrific. And I liked so much of what Elizabeth said, much resonated. And hopefully after I answer your question, I'll come back to digital is not always the solution, because I think that's an important issue that Elizabeth mentioned as well. We have a real opportunity in Uganda right now. As I mentioned, part of our engagement with ICOS, operationalizing ICOS in Uganda, is around some of those governance issues, but then we dig deep at that last mile, as you've mentioned, to provide our community health workers with digital tools. We're only able to do that in a select number of districts at the moment. However, with additional funding that will be leveraged from the Global Fund and otherwise, we will be able to support Uganda in this transformation for digital support to the community health worker. But I think an important aspect that you brought up is what's happening at the parish level. And I'd love to tell you a little bit about the parish development model. I had a great conversation with one of the commissioners of planning at the Ministry of Local Government yesterday. I just want to highlight that it's important for all these different initiatives that come into play to be government-led, that we, when we're developing solutions, are embedding ourselves within existing infrastructure and architecture and governing bodies that are led by the host governments that we're serving. And so what I think is interesting on Uganda's digital transformation journey is that after many, many years of discussion, I think 10 years in total, in this fiscal year, the parish development model was launched. And one of the key pillars of Uganda's parish development model is something that speaks specifically to community data and community information systems. Now, when we think of Uganda's administrative levels, the last fiscal unit has traditionally been at the district. And now with this real mandate that's come directly from the presidential level, now we're seeing a fiscal administrative unit at the parish level, which is just one step above the village and the community. So the parish development model is meant to be really something to poverty alleviation, empowerment of the people. There's another pillar about mindset change. So I think this is a real government-led specific engagement with funding by the government to be able to transform communities for poverty alleviation for the government, for all Ugandan citizens. So what I think is unique is that we have an opportunity through the multiple, ICT, UBOS, who's a traditional sort of gatekeeper of data, maybe more survey related data rather than administrative data where, for example, the Ministry of Health may lie. But now there's a way to sort of support all of these cross-sectoral engagements to be able to bring in, registries, household registries, which is work that we are very closely engaged with from the Ministry of Health. So I think the opportunity is ripe. And I think what we also have is a very strong enabling environment in a political way that will help Uganda reach this digital transformation in an authentic way, and will actually engage and sort of light a spark for cross-sectoral collaboration across different ministries like local government, like Ministry of Health. We're moving from this sector specific to a more program-based budgeting approach in the government of Uganda. So thinking about human capital development. And I think, as Elizabeth mentioned, thinking about, the clients, thinking about the citizens, and thinking of how this is really the central structure of what is the aim of the parish development model, to ultimately allow for livelihoods, creation of new jobs, economic empowerment, but being able to do that by understanding in a digital way who actually sits at the community. And I think it allows for this incredible, authentic cross-fertilization across MDAs in a way that we need to ensure that there's close collaboration across all these different parties. And I think having this finally reach the budget through the Ministry of Finance is a significant pivoting point for Uganda. Thanks.
Great, thank you. You've given us a lot to think about there in those reflections. And I loved how I heard both your remarks and Elizabeth's, this idea that digital is not just about changing the format in which we are communicating. It is triggering a much larger transformation process that requires new policies, new processes, planning architecture, and really importantly, thinking about building capacity at all levels of the health system, everywhere where you're going to have an individual interfacing with digital systems to ensure that they have the skills and the incentives also are in place. That's one thing we haven't talked about, but using digital transformation as an opportunity to transform health systems so that we are thinking not just about pulling data up for reporting and analysis, but contextualizing information and sharing it back to the point of origin to enrich insights and to create new opportunities to enable decision-making that takes into account the full life cycle of the data as it is collected, shared, and then analyzed so that it can be used both nationally and locally. I want to thank people for putting some comments and questions into the chat. I'm seeing that Thep, I hope I pronounced your name correctly, from the Lao Ministry of Health is commenting that the Lao Ministry of Health will work on building a national digital strategy in health for Lao. And so that's fantastic to hear about. And if you have some specific questions or observations that you want to add in, please do share those as well in the chat, and we'll keep bringing those forward. And then we had an observation from Emily at VMO talking about the opportunity to integrate digital connectivity to communicate directly with populations, with clients, with citizens. And in this case, she's talking about in the context of COVID-19. So Chris, I'm going to point it over to you next, but maybe invite you to talk a little bit about the work that Elizabeth shared that you guys are working on together in Ukraine. And then pivot from there and share with us, are you guys also working in the COVID-19 space? We had Emily in the chat talking about how in Malawi, self-reported data on hotspots and potential outbreak areas was insightful enough that the Ministry of Health is now integrating this data collection tool into the way that they are doing their surveillance and planning. So what does that look like from your perspective, and what opportunities do you see?
Great, thanks. Actually, you teed me up really nicely for this. So you're talking a little bit about how, just a minute or two ago, about how digital has created opportunities to solve some other problems that maybe weren't, explicitly what we were after. COVID has actually done the same thing in my experience. So, like, one thing I think we've seen over the last year is like, right, if we're going to have to, we as in, a Ministry of Health in a low and middle income country implement a mass vaccination campaign that targets our whole country, not just children, we're going to need to make some digital investments and able to do that effectively. And oh, by the way, we probably needed to have made those investments for scores of other things. So one of the things that I have seen across a ton of countries where people are using premise, and this includes Ukraine, is foundational data, especially on health facilities. So, working with Elizabeth, one of those is just that the data on like which health facilities are still open, whether that be in parts of the East where they're affected by conflict, or just other parts of the country where health facilities move around, is super important if you want to be able to like figure out where you can get health services in Google Maps or in any other, electronic system. Kind of taking that to I think a little less advanced scale. One of the things we've seen is, like in Sierra Leone, for example, digital microplanning, which if you're not familiar with it, is the idea of being able to generate, a detailed plan for how to deliver sort of campaign-based health services. So sending people out into the community. It's really important for immunizing kids in underserved areas. It's also really important for like malaria bed net distribution, right? Well, suddenly, countries are going to need to do that when they haven't before. And so it's like you get countries that have been affected by polio, like Nigeria, who are like really in a good place to do this already. And then you get a country like Sierra Leone that's like missing 25% of its government-run health facility, location data. So we've got people doing this: Ukraine, Cote d'Ivoire, Sierra Leone, Mali. And I think, that sort of data is going to pay huge dividends for other, other parts of the health sector, not just COVID. The other one is what sort of Emily referred to in the chat. Like, this is terrible about COVID, but it's also kind of forced us to up our game, is right. You have people's opinion about both the vaccine as well as sort of like knowledge of how COVID is contracted or whether they're at risk or not, changing all the time. And that means you really have to kind of integrate, the sort of like sentiment of your population, whether that be through polling data, as well as a way to then go back and impact that into what your sort of like your routine workflow, as opposed to creating, treating that as some sort of like set aside project, right? I think a lot of progress has been made in that over the years when you think about some of the like messaging work on like for maternal, newborn, and child health, same, hand washing, some of that. But for COVID, again, now we're after the whole population, not just like a subsegment. So I think, Emily, what you said that Viamo and you were doing in Malawi is really cool. I think that's exactly where we're going. We've seen, government of Tunisia and UNICEF have been doing a similar thing with Premise. And there's also some really great work going on now by the WHO and the Foundation for Innovation and New Diagnostics to try to do the same thing, but with access to COVID self-tests, right? It's like, unfortunately, we're going to still need to be testing people for COVID all of next year. Not everyone's going to be vaccinated. It's not going to go away. But like, if we're going to roll that out, we need to understand, how we can do that. And we need to be able to kind of pivot how that goes based on population's willingness to even use those and buy those in the first place. And so there's a real opportunity for kind of like continuous citizen generated data there. Hope I got all you wanted me to, Adele.
Yes, no, that was great. Thanks. Yeah, I think you hit the nail on the head in terms of the COVID-19 pandemic being tremendously disruptive, but also really highlighting where we have important strategic opportunities that we need to get right as we respond to the pandemic. There's billions of dollars flowing into the response. Not all of that is going to health information systems and as part of that, digital technologies, but a significant chunk is. And so we want to make sure that as these investments are being made, as we're delivering on national plans, we're thinking about it from an infrastructure perspective, as well as where there are new opportunities with increased access to digital to talk to people directly. That to me is one of the most exciting things about this space, that ability to create feedback loops between actors in the health system who previously were not able to directly communicate with one another. And so if you can take data and information from sentiment analysis and connect that with NGOs, who in turn can work with, and governments, who in turn can work together to create messaging that is addressing the current root cause of vaccine hesitancy. That's so powerful. And we saw some really wonderful examples of that model during the West Africa Ebola outbreak as well, leveraging a whole range of different communications channels, right? I mean, we keep hearing digital is not the silver bullet. Digital is not always the right answer. And so when it's not the right answer, let's make sure we're not promoting it for the sake of promoting a shiny tool. But let's think strategically about how it can be interwoven alongside billboards and radio, and using affinity networks, whether they be faith-based networks or others, to get really important information out. And then whenever possible, to try to bring that back in so that we're creating those feedback loops that enable communication and adaptation, that enable empathy, all things that are really important components of how we communicate about things where we have shared value. And I think digital is part of that equation, although not always the full answer. So maybe what I'll do here is pause, and Elizabeth and Jessica, invite you to share any reflections you have on how COVID rather has impacted your work. And maybe Elizabeth, in your case, if you're seeing as part of the policy development process, an increased prioritization of things like, you know, how we're registering facilities, or fundamental parts of architecture that can support the wider digital transformation journey in the health sector, but that we know from a COVID-19 perspective, we want to get those investments right to not only meet these urgent COVID-19 needs, but really, again, be a good partner to countries as they plan that larger transformation journey.
Sure. So I think piggybacking on what Chris had said, and highlighting a little bit more about some of the work that we've done together here in Ukraine, the citizen sentiments for us here was very critical for a variety of different things. So first, I think to really understand and confirm some of the assumptions that we had. The reform is new, and so being able to access all the as many citizen sentiments as we could in as near real time as possible during COVID, when we weren't able to travel as readily and go out and really interact with people like we would have been, I think really helped us be able to target our activities and technical assistance to the government better. Additionally, I think we felt that the messages for us have always been, like Jessica said, owned by the government. The government is the face, they are the drivers for the decisions that they make around these topics. But I think for us, being able to help them understand that it isn't just like a budgeting and a financial piece. There are people here at the healthcare facility level that with the reform have now gotten some additional autonomy and power to make decisions and choose quality healthcare, not just healthcare that is available to them. And so I think for us, being able to help the government quantify and actually like pinpoint where some of these premises are was a big step for them. I mean, they have a repository of the data, but like being able to go out and verify where things are, where, you know, maybe it's an administrative building, but not necessarily where you go to get services, I think for us will help build continued trust in the system. There is low trust here in the institutions and the delivery, in particular when it comes to quality delivery. And so one of the things that we have seen through COVID as well, and through the work with Premise and being able to gather these sentiments, is the importance of starting to build some of that trust. So like Adele also said, looking at the entire ecosystem at all of the levels, all of the tiers, and being able to continually help shape the new behavior and change that is upon all of us. I think COVID obviously made this an accelerated learning opportunity for everyone. But I think the building of trust in these technologies, as well as in the institutions that are deploying a lot of these tools for access, is very important to cement the changes that we want to see in the future, and really helps us from just doing digital to becoming digital fully. I think one of the key pieces there as well is, I think oftentimes like making sure that, again, the digital divide piece, that there is a lot of access for maybe, marginalized groups or smaller minority groups that may not have as much access. But like Adele said, it flows both ways. You can gather a lot of data, but it's also a great tool to be able to disseminate a lot of data, especially during pandemics like COVID. I think if you are not able to secure these channels, however, and build trust, you really run the risk of making them vulnerable to malign actors. I think, in Ukraine, in other places around the world, we have seen how COVID has acted as this, conversation piece to either, delegitimize like the efforts of the government. And I think in vulnerable political environments, I think it's even more critical for us to ensure that we have these foundational pieces in place.
Thank you. Yeah, I appreciate all the reflecting that we're doing on this issue of trust. I think it's probably not something that shows up on any e-health building block diagram, or probably doesn't feature prominently, if at all, in policy documents, but is so critical. It's a great example of this wider use environment where if we don't consider it carefully in how we're designing and building, we can really miss the mark. And so, Dr. Oyugi, over to you to share a little bit about what you're seeing from the community perspective as part of the COVID-19 response, and what you're learning from these communities as you think about the path forward.
Sure. There's so much that Elizabeth shared that I wanted to try and unpack a bit. It was hard to know what to choose from. And I think, when you talk about rumors and you talk about vaccine hesitancy and you talk about all these issues, there's so much of a foundation at the community level, and whether you're using the WhatsApp chats that can help distort a lot of the appropriate policies, that is a technology. Whether you think about how to support our communities to provide the right messaging through, government leadership, again, that's another opportunity. It's nice to hear from our Viamo colleagues in the crowd, because I know you've done work as well in Uganda with IVR. And I think it's really critical to think about how we can triangulate and bring together all these different pieces of technology to support appropriate messaging using that foundation of communities. I wanted to touch as well on some of the issues around partnership. And although we're not talking about trust in the sense of how it's come up in terms of client trust to be sure we're getting messaging across, but something that we haven't touched upon that I think is important, which is trust in data. So when we think about all this data that's being collected, what can we do as technical partners? And we're doing this through one of our partnerships with DataKind, to be able to interrogate the data that's collected and use analytics to understand where there may be, intermittent or inconsistent or problematic data, and to use as broad data and big data and AI and sort of the more sophisticated analyses to be able to understand how we can ensure quality data that can then be used for the best decision making at all the different layers of the decision making, from the community to the district, subnational, at the policy level as well. So just to sum up, I think that COVID, of course, has been a horrible catastrophe, but it's enabled our communities in Uganda. It's given us this potential to think about things from a very cross-sectoral way. It's given us the opportunity to deploy digital tools to support those community last mile health workers with better supervision. So feedback loops that can get to the supervisors and ensure that the right decisions are being made, that the right referrals can be made when necessary to reach a facility. So I think we need to think about those silver linings and what we can use and what we can learn from those silver linings to propel us further on this journey for digital transformation in a way that doesn't just support the health sector, but broadly supports the cross sector for Uganda, especially as Uganda embarks upon this new parish development model.
I love your comment about trust and data. It's so critical. It's such a multifaceted issue trust, right? It's about the personal relationships and the relationships between people and government institutions. And as there is this transformation process, we need to be thinking all along the ways in which trust is interplaying with this journey that we're all on, and data, certainly. I mean, I think already there is probably a pretty widely held impression, if you were to ask people, about what happens to your health data. You know, where does it go? Do you see it again? Do you feel like you know your own health data, or does it get collected and move? And I think, you know, that's probably a universal challenge, but certainly something that I know a lot of people are thinking a lot about, this question of data governance and trust, and something I'm glad that we're threading in as part of this discussion. And then speaking of ML and AI, I see a comment in the chat. Wayan, thanks for sharing that forward, from Ime Asangansi, I hope I got that right, from eHealth for Everyone in Nigeria, who's talking about some virtual reality health projects that they have underway to help support learning around neonatal resuscitation, and then some other hospital-based activities using virtual reality. And so, and then in the last example, talking about anxiety in the metaverse. Wow, I mean, it's changing so fast, this space. I think that's both what's challenging and also really exciting about it, is that this conference is a lot different than the one we had last year, simply because the space evolves so quickly on both the kind of shared understanding of what the opportunity and challenges are around digital transformation and the respective roles we all play in that equation, but also importantly, on the technology side. And so it's really interesting to hear that example of some of the ways that, in this case, those new emerging technologies are being used. So maybe we can hear more from you at next year's panel. Submit an abstract if you haven't already. So Chris, I want to point it back to you and just come back to this question about how we can be more client-centered and client-driven, and how we can use these new opportunities to communicate directly with clients to have that inform our planning and our delivery. And do you have insights or recommendations based on your experience about what governments or what funders can be doing to make sure that we're really fully harnessing, understanding, but also harnessing that opportunity?
Yeah, you know, honestly, I think the technology is there already to be able to get better data from, you know, citizens, from clients or consumers of health services. Where I see a lot of the gaps right now are on making that data easily usable and integrating it into the workflows of those who can do something with it, whether that be at the national level or the local level. And you know, one thing, I think honestly, it took me a few years at Premise to really kind of wrap my head around this. But like those of us working in this space, we often talk about data visualization like that's, oh, and there needs to be data visualization, and like it's so freaking simple. And what I've noticed is that there's actually like very different audiences when it comes to that data. So, you know, two I've noticed is like, you've got a certain group of people whose job is going to be to try to generate some insights from this data, and they need one set of tools. I think the good news is a lot of the work that they're doing is pretty common, regardless of what type of data you're running. So like being able to try to test for statistical significance in survey data across different like subsegments of the population, for example, super common. On the geospatial side, being able to like easily combine, you know, multiple pieces of data about one place into a single record so that you can look at it all together. So, you know, that's a big chunk of work that I think, you know, gets done by the sort of like GIS analysts at a national, you know, sort of statistics organization in a government, or it's being done by, you know, sort of like an analyst type person within like the appropriate part of the Ministry of Health. That's one set of tools. I think we're getting there on developing that, but we're probably not quite there. But then the other is like, you know, a decision maker doesn't want to look at any of those things. So like what they need is like 3 things I need to know based on this data, the 3 main charts that show that, the end. And they're never going to look at anything else. And so I think one of the places we can make a lot of progress is just like start to differentiate who the audience is for this data, whether it be citizen generated or otherwise, and like craft the tools based on like what they're ultimately trying to do with it. But then if we do that, it becomes so much easier to use data for routine decision making as opposed to just the really big decisions where I think we're doing a much better job of it already. But if you're working with like citizen generated data or real-time data really of any sort, that's what you're trying to do. It's the like, this week, this is what we're doing. How do we actually make that decision using data? That type of stuff I think is still really hard right now.
So let's pick that up and pivot on that. So first, Jessica, to you, this idea of who is the audience? What do they want to know? Who are we trying to reach? And what are the human-centered design opportunities there to be thinking about that in a way that's going to meet people where they are and give them access to the information they need?
Yeah, I was reacting when Chris was speaking, because I think, this is so important, this sort of emphasis on user-centered design. And part of our partnership with the Living Goods, with Medic, with DataKind and BRAC is around making sure that we understand the user across that whole value chain. So the user might be the client, the user might be the community health worker, the user might be the district health officer, or the user is the Minister of Health herself. And so I think really ensuring that we understand who that user is and that the audience is very different, and then tweak those visualizations so that they can support who needs to be able to interpret the data for decision-making at a high level, or for very granular decision-making to know whether or not so many breaths per minute means you must ensure that that referral kicks in for the community health worker to refer someone to a child with pneumonia to the facility. So I think that's a key tenet of our support in digitizing some of the systems. But I want to highlight something that Wayan has shared with us from one of the audience members around, digital and scale cannot go everywhere. And I think that's a really valuable point. And part of what we're trying to intervene with and sort of create in year 3 of our ICOS work at UNICEF Uganda with Rockefeller is an investment case, and really start to understand, what does it mean? We can talk about digital being this one size fits all and sort of, rocket system solution, but we know that it isn't it. So there are other areas where smart paper technology will take off, or just scanning a document that can be integrated into DHIS2 will make the most sense. There are places where paper will have to remain in place because we simply either don't have the connectivity, or Elizabeth, as you said, certain users simply just don't have data that cannot always be supported either by partners or government. And so I think it's acknowledging what Christina has raised, meaning that we may not be able to scale everywhere, but whether it's user-centered design for that technology, looking at the community health worker, looking at the client, looking at the midwife, and all the way to the Minister of Health, I think it's also understanding the geographies of where we work and sort of being agile enough to understand that different solutions are required in different places. And I think that takes a lot of courage, because sometimes we come in as thought leaders or technical partners. We had great work in Uganda with DDI last year, where we thought we were going to be looking at mobility tracking and telecom data to support the government of Uganda in understanding what's happening with COVID. We learned that we needed to sort of pivot and think about, well, if we're in lockdown for a long time, we need to better understand that women and children are receiving the services that they need in the time that we're locked down. And so that work shifted very quickly instead to make a tool that would support the Division of Health Information with understanding what service utilization looked like for women and children. So I think it's that importance, and Wayan will remember this from our time last year, of really being agile. It's okay to sort of fall back and then move forward and sort of respond to your audience and what's needed, and really focus our work on the user, whoever that might be. Thanks.
Elizabeth, I'm watching you nodding vigorously over there on some of these points. So please share with us your thoughts.
Definitely a lot of agreements across the board with both what Jessica said, Chris said, also with our audience comments about the fact that you can't always scale up. Not everything is scalable to the national level. I think something really important to remember that, luckily for our project, I think not all projects have this. The benefit is that we actually cover quite a large spectrum of this value chain, like Jessica put it. I think we do provide technical assistance to the minister, to the ministry, to other national level stakeholders like the National Health Service of Ukraine. But we also do provide technical assistance services to the healthcare facility worker. And so you're looking at this broad spectrum. And I think one thing that our project has really learned and tried to also convey to the Ministry of Health is that it's really important to understand your digital ecosystem. I think oftentimes in these very fast-paced moving environments, and of course for the health space with COVID, I think a bigger emphasis on this sector within governments and pressure has been placed on data, in particular on budgeting. I think, is to understand this digital ecosystem. What does it mean? Like, who do you have in it? Who do you think you have in it? Who would you like to also play a role? Like, for example, the private sector. I think all of us would love to have this integrated approach, but I think oftentimes we don't fully understand the roles that everybody is already playing. So it's important to really, map out this framework, maybe again, looking at taking a little bit of a step back and creating some like baseline information you can all talk to. And ensuring that what you are planning has this context built into it so that it informs where you're going, what you're doing. Like for the data piece, like Chris said, the data could be there. Like in Ukraine, the largest growing sector in the economy here is IT. And so there is a lot of IT. There is a lot of potential to mine data. But one of the things that we saw based on some of the work that we were doing on digital literacy is that digital literacy and data protection understanding was very low across the healthcare facility worker level. So you may want these digital or these like visualization and dashboards and stuff at the ministry level, and you may be pushing these healthcare facilities and others to provide data. But it's like garbage in, garbage out. You won't have what you're really looking for in these like very nice looking dashboards. And I think just bringing on, again, the safeguards, really considering cybersecurity, data protection. I think for us, the way that we look at this is, again, Ukraine being where it is, I think has some additional considerations, but I don't think those are unique to Ukraine. I think those currently exist all over the world in terms of cyber risks. But making sure that your system is not vulnerable to malign actors. And, I think it's important to remember that you have to tackle both of those pieces at the same time. So with the half-built plane that's flying, just remember that you need to tack on some of these understanding pieces and build capacity while you are introducing these tools for data-driven decision-making to be sustainable and work in this environment.
Excellent. Well, this has been such a robust and fun conversation. I love how we are all circling around some of the same points, despite the fact that we're working in different geographies, at different levels of the health system, from different stakeholder perspectives. And I think that is a really nice validation of some of the core opportunity areas and need areas in this space as we continue to take stock of where we are in digital transformation, moving from the margins into the mainstream, and doing this in a way where we are keeping people at the heart of all of this. And sometimes that can be hard when we're thinking about interoperability and standards, and we're talking about national digital health architecture blueprints and financing. It's easy because each of these domains is so specialized and technical to get steeped in that subcomponent. And yet here we are all talking about the critical importance of trust, particularly in the context of COVID-19, and making sure that we are building in a way that can reflect trust in everything that we do, including all the way to mapping how systems connect with one another so we can get access to shared data. We need to go back to the people whose care we are trying to support in everything that we do. So I have really enjoyed this opportunity to speak with you all. I know we didn't get to all of the questions in the chat, and there was one, Chris, for you about getting access to your data. And so maybe what I'll do is just acknowledge that we do have now back today the Cvent platform that has a networking component. So if anyone in the audience has additional questions for the presenters, try to find them that way. Because we would love to continue the conversation. So thank you so much to Deloitte, the sponsors of this panel. Thank you, Wan, and everyone else involved in organizing and bringing us together. Enjoy the rest of day 3 of the Global Digital Health Forum. Bye, everyone.